What's the first thing you notice when you meet someone? Is it their eyes, their clothes, or is it their smile? Studies show that smiles are powerful. They can break the ice, build trust, even boost our mood. But what happens when smiling becomes a source of pain instead of joy?
Little Lisa is going to need braces.
Oh no, I'll be socially unpopular.
Are you sure, Doctor?
Well, judge for yourself. Here's Lisa today. Without treatment, here's what she'll look like at age 11, age 14, age 17, and finally, age 18.
Cool, she'll be a freak.
But
We can stick her in a trailer, drive her around the South, and charge 2 bits a gander.
And teeth aren't just for aesthetics. They're essential for good health. Did you know that healthy teeth and gums can help reduce the risk of systemic diseases like diabetes and heart disease? So with all these important reasons, why has the British government allowed a dental crisis to unfold?
Let's look at a picture book. The big book of British smiles.
It got so painful and so wobbly, I just started pulling them out.
I yanked out one of my back teeth because I was in so much pain.
Teeth she had pulled out herself.
First impressions are judged by your smile.
Sound silly?
Tom?
Being married is no excuse to let needless bad breath and tooth decay make romance fade away. So keep your romance fresh with Colgate.
That's enough! That's enough!
In this video, we're going to look at what has caused this, how much each is to blame, and I'm going to break it down to 3 causes: austerity, Brexit, and COVID. Austerity.
Britain's economy is damaged. The education system is failing students, with schools facing shortages of both funds and teachers. Britain's police forces and courts struggle to pursue and prosecute criminals. Various public sectors, including transportation, mental health care, and asylum services, are suffering from a theme:
Poor austerity.
inadequate government funding, and this appears to have been intentional. Beginning in 2010 with the election of David Cameron's government.
Are we facing more austerity, Prime Minister?
So we've got to make more cuts. And another 6 years of cuts.
Government policy had an effect on health and social care, which meant that those in the worst situations of society were disproportionately affected when COVID hit.
The Tories say austerity is like tightening your belt. They just never mention that it's around our necks. And every time they dine out on lobster, they give it another yank. And if you think I'm joking, just look at the following bills. £15,000 in damages bill, after MP Michelle Donnellan accused an academic of having sympathy for Hamas. Liz Truss left us with a massive in-flight food and booze bill of £1,000 per head, with a flight to Australia taken by private jet, because obviously she's too good to fly with the rest of us. That pales in comparison to Priti Patel, who managed to cost £340,000 in a settlement with ex-Home Office Chief Philip Rutman, simply because she's a bully. Austerity had a profound impact on NHS recruitment in general, as well as dentistry. And this was caused because there were salary caps and pay freezes. During the period of austerity, and we're going to say this from 2010 to 18, the public sector pay was capped at 1% annual increase. That's significantly below inflation, with inflation hovering anywhere between 1.5 and 4%, with the exception of 2015 and 16, where it was below. But apart from that, over that entire period, NHS staff have been receiving a pay cut. Historically, and prior to austerity, the average rate of increase in NHS salaries was at about 4%. And with an already highly stressful job, this has not done much for staff morale and retention. In 2017, a report by the College of Nursing highlighted that 56% of surveyed nurses consider their pay inadequate relative to their job responsibilities. Furthermore, NHS staff surveys consistently showed that nearly 30% of NHS staff reported considering leaving their positions due to dissatisfaction with pay and working conditions. As much as we understand that staff are there to care for us, and they want to, and they do it out of love for the job, they're in a highly stressful position, and on top of that, they've got to put bread on the table. And the damage didn't end there. Because of the wage increase going up so little, it meant that dental recruitment was also a problem, and this was further damaged by the NHS training budget in England being cut by 17% between 2010 and 2015. So between 2014 and 19, there was 10% reduction in the number of training dentists. And it gets worse, because between 2015 and 20, in England, there's a decrease of people staying in the NHS and then moving into private practice. And it wasn't just austerity. Brexit also had an impact on retention and recruitment.
Good evening.
To protect the NHS
can protect the NHS's ability to cope.
Protect the NHS. Save lives.
That stay-home order during COVID-19 had a significant impact on dental care services. From March 2020, nearly all routine dental care was suspended, and that led to a cancellation of an estimated 19 million dental appointments in England alone by the end of 2020. And even after the easing of the initial lockdowns, dental practices continued to operate at reduced capacity due to new infection control measures, including enhanced PPE. A survey conducted in late 2020 found that only 36% of dental practices were operating at even half of their pre-pandemic capacity. As of 2021, it was estimated that the backlog of patients waiting for dental care could take years to clear, with some areas reporting average waiting times increasing by 12 months. The long-term consequences are that people's teeth deteriorated, and there's an economic impact, but I'm going to keep that till the end of this episode. Government did initiate a number of programs to try and mitigate the damage created by COVID.
Clearly, this is what we're announcing today is billions more going in to support the UK economy, to support jobs and livelihoods, and that's right.
They offered discounted or free PPE. In 2021, it was announced that 50 million would be allocated to help tackle the backlog. But as you can tell from the numbers earlier, 50 million isn't going to touch the surface of this problem. It's now been 22 months since the last lockdown, and this backlog could have been cleared by the government if they had pursued an aggressive policy. They could have done stuff such as public awareness programs.
Infected teeth or gums, every bite of food forces germs from the infection into the bloodstream, which carries the poison on to every part of the body. And this may cause very serious illness.
That's a very jolly prospect for me.
Or free toothpaste, free toothbrushes. And let's be honest, they probably should have put a tax on sugary sweets and drinks.
The greatest moment in the modern history of our great nation. Thank you!
47 years of history brought to an end in the name of sovereignty and independence.
This is the dawn of a new era. It is potentially a moment of real national renewal. The most important thing to say tonight is that this is not an end, but a beginning.
Brexit had significant repercussions for the NHS, and specifically for dentistry. According to the NHS, 5% of its workforce in England are from EU countries. That's roughly 70,000 members of staff. And as soon as Brexit happened, according to the General Medical Council, the GMC, it noted a drop in numbers of EU doctors registering in the UK by 90%. In dentistry, the British Dental Association reported challenges in recruitment and retention, particularly in areas previously filled by a significant number of EU dentists and dental nurses. And that was in part because of funding, job satisfaction, even racism. But of course, it wasn't just there. Brexit also did damage to the economy. There are problems with currency and currency fluctuations. The currency dropped immediately after Brexit, which means that anything imported into the country is now more expensive. And despite promises of no paperwork,
there is no need for a free trade agreement to involve accepting EU rules on competition policies, subsidies, social protection, the environment, or anything similar, any more than the EU should be obliged to accept UK rules. There will not be checks. There will not be checks. I speak as the Prime Minister of the United Kingdom and a passionate unionist. There will not be checks on goods going from Northern Ireland to Great Britain.
That border had to move to the Irish Sea. Now, there were strong objections from unionists in Northern Ireland about the prospect of essentially an internal border between Great Britain and Northern Ireland, but it is something that the UK government does seem now to have had to accept that there will be checks on some goods flowing between Great Britain and Northern Ireland.
But for wholesalers like Hemskirk, the introduction of long-delayed Brexit checks at the UK border mean it's about to get more difficult and more expensive to do business.
So it is 100% checked, then it's coming to us. We check it now again.
And now someone comes
and
to
then
check
it
it for
goes
the
in the
UK.
truck, we have to check it again, and then in the UK, we check it again. But it's making an awful lot of costs, and somebody has to pay the bill at the end of the day. So I'm 100% sure that the last customer, the British consumer, has to pay for this.
Which includes anything to do with dental. That has added 10 to 15% just to the price of the product.
It was always clear that in leaving the EU single market that there would be additional frictions at the border, and that has taken a long time to actually be implemented, and today is the day.
This would have been an act of self-harm if we'd gone ahead with it. It would have increased costs for people, and we are trying to reduce costs. So that's the purpose of not going ahead with them and trying to ensure that the border flows as smoothly as possible, which benefits everybody.
But there's also economic growth. With Brexit, it's done between 3.9 and 6.7% worth of damage to the British economy. That means less tax revenue, which roughly totals at about 40%. Which is interesting because when you add up all the new tax increases, it actually adds up to about that amount. So, corporation tax going up by 19 to 25%, national insurance increases, as well as VAT and duty charges, and the tax freeze threshold. That totals up to about 40 billion. Isn't that interesting?
Broad, sunlit uplands.
Brexit is simply less staff, more tax. And bear in mind, a lot of experts have said that Brexit is as damaging as COVID, except COVID has only lasted for a few years. Brexit continues on and on until we rejoin the EU. So short term, I would have said COVID. Long term, it's definitely Brexit that has caused the most damage to dentistry in the UK. Let me know what your thoughts are. Once again, thank you to all of my supporters, my Patreon supporters, my YouTube supporters. You keep this channel going and growing. It allows me to buy cups of coffee to stay up all night to make more stuff like this. Thanks for listening. Bye for now.